Well, howdy YouTube family. It is Bolt CRNA coming to you again with another week's topic. This week we are going to talk about personalities. Most specifically, if you have the right personality for anesthesiology. There's a lot of rumors out there about the certain types of persons or personalities that fit into anesthesia and which types that don't. And there's some myths to some of it. So we're going to talk a little bit more about if you fit right for anesthesia today. Let's get into it. First things first, I think a lot of people have a misconception that anesthesia, we just sit behind the drapes, we never speak to anybody, we're antisocial introverts. Similar to how some people refer to like radiologists. They assume that all radiologists are just like super nerds that are pasty skinned and sit in dark rooms and like, you know, those computer nerds that sit in their parents' basements for the rest of their lives or something. It's just not accurate. I mean, there are some of them, but it's not accurate to stereotype all of them like that. And same for anesthesia. Anesthesia, people will think, oh, you never talk to anybody. Your patients are always unconscious and asleep. You only pick anesthesia if you don't like people and you don't want to talk to anybody. That is really not that true. Obviously, I picked anesthesia and that's my specialty and I talk all the time. Obviously from YouTube you can tell that. And you can find quite a few other people in the anesthesia world who also are on social media and talk and interact a lot. So it's not a good stereotype to say that all of us are just introverts that don't like to interact with people. There is an element, I mean, if you are the type of person who wants to constantly be speaking to your patients and you want your patients conscious all the time, then yeah, I mean, I would say anesthesia is probably not the best pick for you because a lot of times our patients are asleep. And if they're not asleep, we're probably not doing a very good job, honestly. Your patients don't usually want to be awake. More often than not, it's funny, I kind of have a joke with my patients sometimes where it'll be a max sedation or it'll be like a spinal anesthetic, which means it's not general anesthesia. They're not fully going to sleep. I'm not putting anything down their throat. I'm not, intubating or putting an LMA in or anything. I'm not using gas. And so I'll tell them, so you'll be breathing on your own for this and I want you to be at least a little awake or something. And they'll panic and they're like, no, I want to be totally asleep. I want to be totally unconscious. And I'll say, you don't want to talk to me at all? And I'll be like, I'm hurt. And they'll say, nothing against you, but I just want to be asleep for surgery. And they just don't want to hear anything. They don't want to hear any noises. They don't want to know they're in the operating room. And I understand that. And so, of course, usually with my max sedations and stuff, they're snoring and snoozing away. They're not awake, but they are breathing on their own, which is key. And so anyway. Yes, there are a lot of times where your patients in anesthesia are sleeping. They are, intubated or unconscious. You have to be okay with that kind of idea of taking care of a lot of your patients that are in that situation. But this is the side of anesthesia that a lot of people don't focus on as much. There are areas of anesthesia where the patients are not asleep. For instance, OB. Like if you go do L&D and OB, obstetric kind of anesthesia, a lot of the times your patients are not asleep. For C-sections, your patients should be fully alert and aware and awake and talking to you and interacting with you. They will get a spinal anesthetic and be numb from the chest or upper abdomen area down to their toes so that they can not feel the surgical pain of the baby being taken out. But they should be awake and alert, looking at you, talking with you, interacting with you. So on days where I cover OB, I may have no patients all day that are asleep. A better way to say that would be I would have awake patients all day. So all day I'm talking and interacting, and it's funny because days like that, they actually can be, even though I enjoy them a lot, they can be emotionally exhausting because you are talking to a lot of people, you're interacting with a lot of people, you're dealing with people in some of the most stressful moments of their lives, but also at the same time some of the most exciting times of their lives, and you're very much thrust into a very private kind of moment in a couple's life where suddenly maybe their first child is being born and they just went from not being parents to suddenly a parent, and a baby's in their arms and it's theirs, and it's their newborn baby's being born, and you're standing there with them at the head of the bed, involved in this moment, and a lot of times they'll hand you their phone, they'll be like, take pictures of us, and you're taking shots and you're trying to be like an amateur photographer for them. And sometimes they'll want you in the photo with them. A lot of times they'll be very teary. You get to see them the first time they're holding their newborn baby, and they're very emotional and moved. And sometimes I'll even get a little emotional, and I don't even have any kids, and I don't even know that I want kids, but in those moments, sometimes I'll just be moved to, be emotional with them because it's such a big moment. So in those days, I will say that it's a very social kind of day. You are talking to people all day long. And then if you're not doing a C-section, you're probably getting phone calls to go do an epidural. And so with an epidural, your patients are fully awake. They're probably going through labor. And in this kind of situation, they're a lot of times in a lot of pain. They're actually experiencing lots of pain, discomfort. They're upset. It's a different type of situation from the C-section where they're, happy and emotional and crying. They're usually crying because they're in pain, and they desperately need you to get this epidural in them. You're struggling with them just to keep them still enough to do the epidural safely a lot of times. And you're dealing with usually a husband or a spouse who is very protective and nervous, and they're looking at everything you're doing, and they're, pacing, and you're trying to get them to sit down. And so you're dealing with a lot of those kind of dynamics and interpersonal relationships in those settings that are not our normal day to day. In the OR, you don't have spouses and families hanging around asking you questions and, watching what you're doing. It's just you and the patient. The patient's usually unconscious. So it's a very different environment. But then after you get the epidural placed in those kind of days when you're doing epidurals, the patient may go to just total relaxation and just be relaxed and resting and just thanking you, and the family's thanking you, and everyone just saying, thank God you were here. You can't believe how much pain I've been in, and I feel so much better now. And you're able just to kind of get that immediate feedback from the patient that you've done something for them, that they really, really are happy you did for them, and they're really thankful for you. And we don't often get that in regular anesthesia because your patients usually are very sleepy after surgery, and they may be kind of in and out of it, is slightly hungover from the anesthetic, and they a lot of times don't remember us, quite frankly. They usually remember like little patchy elements of interacting with us or meeting us, but most of the time patients don't recall you very well in anesthesia. So it is nice to do something like L&D occasionally where the patient's completely alert and oriented. They know who you are, they remember your face, and they are very thankful for what you've done and appreciate what you're doing for them. So you get those really good patient interactions like that. Another place that you may go work where the patients actually get to interact with you some is GI centers. Usually in GI centers, they're not going to be awake. They'll go to sleep throughout the procedure portion, but you won't usually do general anesthesia. You usually do propofol, just a little bit of propofol. Well, maybe a lot of bit of propofol, but essentially they will go to sleep very quickly, but then wake up very quickly too. And sometimes they can wake up fairly quick after the EGD or colonoscopy and remember you and interact with you. So you may have a decent amount of time that they're interacting with you and connecting with you. So that's nice. Some people like that. Another place that you may work in anesthesia that's not what you normally think of when you think of anesthesiology is eye centers. So if you go do eye cases, like I like to do an eye day every once in a while where I'll go and just do some basic vitrectomies or some cataracts or something simple where you just give a little bit of Versed and fentanyl. In fact, with cataracts, they like you to give very, very little sedation. They really, because they want the patient to be able to keep their eye open and to be able to look at certain lights and, interact with the ophthalmologist as much as possible. So they don't want you to put them really asleep. So the patients are very alert and oriented, and they're talking to you and they remember you and interact with you. So usually on eye days, you may do 10 or 15 eye cases in a row, and those patients will be pretty much interactive with you and talking to you the whole time. So that's a high level of talking and interacting and just like frequently seeing another patient, meeting a new patient, a new patient, a new patient. That's a very, very social day. So if you're the type of person that doesn't like socializing much with patients or maybe that's a bad way to say it. You're a type of person that considers yourself a significant introvert and you do better with short burst of interaction with other people, then the OR is a nice environment for you, because the OR you interact with them in the preoperative setting for 5 or 10 minutes and get their pre-op assessment done and make sure they're safe for surgery. And then you take them back to the OR, you push your induction meds, you secure an airway a lot of times, and you manage them throughout the case. And you do have, you pin your drapes up where you're at, and it's you and your machine and your computer, and the rest of the OR staff, if you don't want to talk to them and you want to do your own thing and you prefer to be by yourself over here in your corner and do something totally separate, if you like crossword puzzles or whatever, Sudoku, whatever jokes somebody has about anesthesia. I don't do any of that, but some people do. Wall Street Journal. You can do that with yourself over by the drapes, and no one will bother you. In fact, you can pretty much be left alone for a couple hours if you prefer. I usually will get bored after a bit of time, and I will stand up. And usually, once you stand up and your little gopher head pops over the drapes and looking at the surgeon and the NP or PA or resident, whoever's assisting them, or the scrub tech, they kind of get the cue of like, oh, this person wants to interact with us now, and then they kind of include you into the conversation a lot of times. And it's kind of like funny, because that they seem to know, like, when you pop down away from them, that you don't want to be messed with anymore, and they just stop talking to you. So yeah, it's kind of nice in anesthesia, because if you're the type of person who does like to be more introverted and you like to be left alone, you don't want to talk to people, they kind of leave you alone. They don't really mess with you too much unless there's something needed to be said. But then if you do like to talk more and be involved in the conversation, you can pop up there. And I know some people, some CRNAs and some physician anesthesiologists who talk a lot, who are very interactive in the OR, and they will, carry on long conversations about all kinds of stuff. So it really depends on your personality and what you like to do. And I think that it's important to dispel the myth that if you have the personality of an extrovert, or you like talking to people, that you would be miserable in anesthesia because you don't talk to people ever. It's just not true. I think that any kind of personality, so the core of this story, of this video, is telling you that any personality is going to be successful in anesthesia if you want to do anesthesia. You can pick anesthesia as your specialty. If you're an extrovert, you can pick it as an introvert, and you can pick it as someone who's in between. You're going to be able to find a dynamic mix of all these types of settings where you can have a lot of that kind of stuff. And that's personally who I am. I'm a person who's in between. I'm extroverted at times, and I like talking to people, and I like interacting, and I want to have those relationships and conversations. But then there are definitely other times where I just need to reboot and reset, and I want things to be quiet, and I don't want anyone speaking to me, and I don't have the emotional bandwidth to like give too much of myself that day, or be too involved in someone's personal situations. Those are days where it's better for me to be in the OR and to not have too much of that to be giving away. So yeah, I think you can definitely have it all in anesthesia if that's what you want. Well, all right, that is my opinion on what kind of personality fits well in anesthesia, but I want to hear down below from you guys. If you're in anesthesia, what's your personality type like? Do you think what I said is accurate? Does it represent a pretty good idea of what it's like to work in anesthesia and the different types of environments you work in? And if you don't think you would like working in anesthesia, tell me why below. What reasons would you have? If it's your personality, if it's the type of work we do, let me know why you think you wouldn't like the anesthesia specialty. If you haven't hit that like button, hit that like button, hit that subscribe button. If you want to join the memberships, go over there and join the memberships. I have study guides, behind the scenes videos. I offer mock interviews for you guys trying to get into CRNA school, all that stuff over there. And until next week, that's Bolt Out.